Assalamu alaikum everyone. Bismillahirrahmanirrahim. Quote of the day: Allah understands our prayers even when we can't find the words to say them. Today, the topic of my presentation is rabies, and I'm presenting it under supervision of my professor, Dr. Sarah Afzal. Learning outlines, introduction, epidemiological determinants, clinical manifestations, levels of prevention, recent advances, and MCQs in the end. Learning outcomes. By the end of this presentation, participants will be able to understand about elements of animal rabies control, elements of human rabies prevention, basic issues on rabies prevention and control, national and global updates. Introduction. Rabies is highly fatal disease of central nervous system caused by Lassa virus type 1. It is a zoonotic disease of warm-blooded animals transmitted by bites of rabid animals. Long and variable incubation period with short period of illness. And unfortunately, there is no treatment, but however, there is prevention only. Now, moving to epidemiology, agent is rabies virus, which has knob-like spikes and protein layer, genome unsegmented, linear, negative sense RNA, stimulate T lymphocyte cytotoxic effect, also has hemagglutinating activity. There are two types of rabies virus: street virus, fixed virus. Street virus is the virus recovered from naturally occurring cases of rabies, and fixed virus is the virus which has short, fixed, and reproducible incubation period. The source of street virus is naturally occurring. It is found in saliva of infected animals. Fixed virus, it is prepared by repeated culture in brain of rabbit such that its incubation period is reduced and fixed. Now, street virus, it produces Nagri bodies. Incubation period is long, that is from 20 to 60 days. It is pathogenic for all mammals. It cannot be used for preparation of vaccine. Fixed virus, it does not form Nagri bodies. Incubation period is constant between 4 to 6 days. It can be pathogenic for humans under certain conditions, and it is used for preparation of anti-rabies vaccine. Now, the source of infection is saliva of rabid animals. Dogs and cats virus in saliva 3 to 4 days before clinical symptoms. Host factors. All warm-blooded animals, including man. Rabies in man is dead and infection. People at risk: lab workers, veterinarians, dog handlers, and hunters. Mode of transmission. Animal bites, licks, aerosols, person to person. Incubation period is normally 3 to 8 weeks, maybe short, that is 4 days, or maybe prolonged for years. And it depends on site of bite, severity of bite, number of wounds, amount of virus injected, species of biting animals, protection provided by clothing, treatment taken. This is the pathogenesis of the symptoms: that infection, bite, wound, then virus multiplies locally in viscera for weeks or months. Then it travels up peripheral nerve to CNS and multiplies in CNS, causing encephalitis. Then virus moves out through peripheral and cranial nerves and reaches salivary glands, skin, mucosal surfaces, gut, most other organs. And then saliva becomes infected for several days, up to 2 weeks before signs appear, and ultimately death occurs. Now, pathological lesion in the brain are Nagri bodies. Symptoms: headache, fever, sore throat, nervousness, confusion, pain or tingling at the site of the bite, hallucinations, hydrophobia, paralysis, coma, and death. Clinical findings are bizarre behavior, agitation, seizures, difficulty in drinking. Patients will be able to eat solids, afraid of water, that is called hydrophobia. Spasm of pharynx producing choking, death in 1 to 6 days, respiratory arrest leading to death, however, some may survive. Stages of rabies infection: non-specific prodromal stage, then acute neurologic encephalitis, coma, death. Diagnosis: the primary diagnosis of rabies relies on clinical presentation and history of exposure to a suspected rabid animal or rabies virus. First is suspected, that is a case that is compatible with the clinical case definition. Probable, a suspected case plus a reliable history of contact with a suspected, probable, or confirmed rabid animal. Confirmed, a suspected or probable case that is laboratory confirmed, usually post-mortem. Rabies prevention and control. It has two components: animal rabies control, which includes primary prevention measures and measures used to prevent the disease at the source. And second is human rabies prevention, which includes secondary prevention measures. Elements of animal rabies control. Rabies control strategies include mass vaccination of dogs, movement restriction, confinement, control of stray dogs. Mass vaccination of dogs, animal pre-exposure vaccination. For effective control, at least 75 to 80% of the population should be vaccinated, should be done at regular basis. Movement restriction is at isolation observation for the period 10 days for dogs and cats, suspect rabid animals. Animal quarantine for 6 months, animal exposed and previously vaccinated. Euthanasia of unvaccinated animals if exposed. If a person got bitten by a stray dog, the wound should be washed and left open for secondary closure. Measures for stray dog control. Create responsible dog ownership among the community, dog registration identification, environmental control like excluding dogs from sources of food, human dog population management and animal birth control. Euthanasia means the act of inducing death in a human manner, and control of dog movements, for example, leash laws, grooming restrictions. Elements of human rabies prevention: avoiding exposure, like avoiding contact with unknown animals, nursing rabid human animal with care. Pre-exposure prophylaxis: it is recommended for anyone who is at continual, frequent, or increased risk for exposure to the rabies virus, such as laboratory workers, veterinarians, and animal handlers. Post-exposure prophylaxis: anti-rabies prophylaxis administered after an exposure. Now, rabies is 100% vaccine preventable, so vaccinate to save lives and vaccinate to stop transmission. Vaccine. Since 1984, WHO has strongly recommended discontinuation of production and use of nerve tissue vaccine and their replacement by modern concentrated purified cell culture and embryonated egg-based rabies vaccines. Nerve tissue vaccines can induce severe adverse reactions more frequently and less immunogenic than CCVs. WHO recommendations apply only to inactivated CCVs since the early 1960s. CCVs have been administered to millions of people worldwide. So CCVs are intended for using both pre-exposure and for post-exposure prophylaxis. They should comply with recommended potency of greater than 2.5 international units per dose for IM injection. Rabies vaccines are currently available only in single-dose vials and do not contain preservatives. Evidence supports administration of CCs by intradermal or IM injection. A systematic review of vaccine potency has shown that current vaccines, when administered by the intradermal route for either pre-exposure or post-exposure prophylaxis, have efficacy equivalent to or higher than that of the same vaccine administered by the IM route. For the intradermal route, one dose is 0.1 ml of CCVs. The vaccine is in one vial can therefore be fractioned to provide 5 to 10 doses for IV administration depending on the vial size. And for the IM route, one dose is 1 vial of vaccine per patient. The concentration of antigen-presenting cells in the derm is responsible for the strong immunologic response to vaccine administered intradermal despite the lower amount of antigen injected. Intradermal administration of rabies vaccine provide a cost-saving and dose-sparing alternative to IM vaccination. As number of patients seen in clinics increase, intradermal regimens become increasingly cost-effective, using up to 85% less vaccine vials. Now, post-exposure prophylaxis. It consists of following steps. All bite wounds, scratches, and rabies by exposure sites should be attended to as soon as possible after the exposure. Thorough washing and flushing of the wound for approximately 15 minutes with soap or detergent and copious amount of water is required where available. An iodine containing or similarly vericidal topical preparation should be applied to the wound. A series of rabies vaccine injections should be administered promptly after an exposure. Rabies immunoglobulin should be administered for severe category 3 exposures. Wounds that require suturing should be sutured loosely and only after rabies immunoglobulin infiltration into the wound. WHO recommends post-exposure prophylaxis for category 2 and 3 exposures. So these are the three categories, WHO rabies exposure categories. That is category 1, in which it's just touching of feeding animals, animal legs on intact skin. That is, there is no exposure to the virus. Then comes category 2, in which there is nibbling of uncovered skin, minor scratches or abrasions without bleeding. However, there is exposure. Category 3, single multiple transdermal bites or scratches, contamination of mucous membrane or broken skin with saliva from animal legs, exposures due to direct contact with bats. This is severe exposure. The WHO rabies exposure categories this in continuation that if a repeat exposure occurs within 3 months of completion of post-exposure prophylaxis, then only one treatment is required. Neither vaccine nor rabies immunoglobulins are needed. Again, these are the three categories that if there is category 1 injury, then there is not a recommended post-exposure prophylaxis if reliable case history is available. However, in category 2, wound management anti-rabies vaccine is recommended. And in category 3, wound management, rabies, immunoglobulins, and anti-rabies vaccines are recommended. So rabies immunoglobulin administration, it provides passive immunization is administered only once as soon as possible after the initiation of post-exposure prophylaxis and not beyond day 7 after the first dose of vaccine. Currently administered rabies immunoglobulins neutralizes the virus at the wound site within a few hours. To confer the maximum public health benefit, WHO recommends the following. The maximum dose is 20 IU for HRIG and 40 international units per ERIG per kg body weight. There is no minimum dose. Infiltrate as much as possible into the wound. The remainder of the calculated dose of rabies immunoglobulin does not need to be injected IM at a distance from the wound, but can be fractioned in smaller individual syringes to be used for other patients. Pre-exposure prophylaxis. It is the administration of several doses of rabies vaccine before exposure to rabies virus. It is recommended for individuals at high risk due to occupation. It should be administered, considered in subpopulations living in remote rabies endemic areas where access to post-exposure prophylaxis is difficult. The dog bite incidence is greater than 5% per year. The immune response to subsequent rabies vaccine boosters such as post-exposure prophylaxis when exposed can be recalled very effectively even decades after pre-exposure prophylaxis. So for immunologically naive individuals for all age groups, WHO recommends the following schedules: a 2 sites intradermal or 1 site IM vaccine administration on day 0 and 7, a routine pre-exposure booster or serology for neutralizing antibody status recommended only if a continued high risk of rabies exposure remains. Individuals with documented immunodeficiency should be evaluated on a case-by-case basis and best receive an intradermal or IM pre-exposure prophylaxis schedule, plus a third vaccine administration between day 21 to 28. Additionally, in the event of an exposure, a complete post-exposure prophylaxis course, including rabies immunoglobulins, is recommended. Requirement for rabies prevention and control, it should be backed by legal framework. Allocation of resources availing vaccines and rabies immunoglobulins, expand diagnostic service, surveillance system, skilled manpower, calibration among stakeholders, community education and participation. Recent updates. WHO key facts. Rabies is a vaccine preventable virus disease which occurs in more than 150 countries and territories. Dogs are the main source of human rabies death, contributing up to 99% of all rabies transmission to humans. And globally, rabies causes an estimated amount of $8.6 billion per year. It causes tens of thousands of deaths every year. Mainly Asia and Africa, 40% of people bitten by suspected rabid animals are children under 15 years of age. Immediate thorough wound washing with soap and water after contact with a suspected rabid animal is crucial and can save lives. WHO leads the collective United Against Rabies to drive progress towards zero human deaths from dog-mediated rabies by 2030. WHO response. Rabies is included in WHO 2021 to 2030 roadmap for the global control of neglected tropical diseases, which set regional progressive targets for the elimination of targeted diseases. It is one of these. As a zoonotic disease, it requires close cross-sectional coordination of the national, regional, and global levels. WHO and Food and Agriculture Organization have launched the United Against Rabies Forum, a multi-stakeholder platform to advocate for action and investment in rabies control, and it can significantly contribute to building of capacity of One Health workforce. In Pakistan, 2,000 to 5,000 cases per year there. And rabies is endemic in Pakistan. Human rabies is not a notifiable disease in Pakistan. And the main vector for rabies in Pakistan is the domestic dog. This is an article titled that Exploring Rabies Endemicity in Pakistan, Major Constraints and Possible Solutions. Some major barriers to control rabies in Pakistan are lack of rabies case data, non-existent target surveillance systems, lack of laboratories capable of diagnosing cases in animals and humans, and perhaps most importantly, a dearth of control programs focusing on mass dog vaccination. This is an article titled as Analysis of Human Rabies Death reported at two hospitals in Karachi. The results of the study states that most victims were males and children were more often affected. Almost none had received post-exposure prophylaxis. A total of 12% of bites were on the face, head, or neck. The mean incubation period was 56 days, and most, that is 60% of the rabies victims traveled long distances hoping to receive treatment. The conclusion was that rabies deaths were either due to lack of awareness or the non-availability of rabies immunological within easy reach. Public health services must raise awareness, conduct surveillance, and provide appropriate space center for free treatment of dog bites. This is a news section that over 50,000 citizens bitten by stray dogs every year in Karachi alone. Every year, around 50,000 citizens are bitten by stray dogs. There is a need to vaccinate at least 70% of stray dogs in the city to achieve herd immunity against rabies instead of killing the canines. Our plan is to eliminate rabies from the soil of Pakistan in the next 10 years, which looks an ambitious target, but it is achievable. Now, moving on to MCQs. MCQ number 1. Rabies is a highly fatal disease of CNS caused by Lissa virus type 1 and is associated with encephalitis, hydrophobia, leading to coma and death sometime. Which among the following is true for rabies? Rabies is not prevented by pre-exposure prophylaxis. The death rate is highest in the elderly. All vaccines can only be used intradermally. Deaths have occurred post-transplant. Incubation period is very short, usually 4 to 6 days. Any guess? The right answer is D. MCQ number 2. A person XYZ was bitten by a stray dog and next 3 days he feels tingling sensation around the wound and unusual pain. He got frightened and came to nearby tertiary care setup. There he was given injections of immunoglobulin. Which of the following is best representing rabies immunoglobulins? It is only manufactured as a human immunoglobulin. At least half the dose should be infiltrated around the wound. Can only be given within 1 week of a bite. If you're really concerned, can be given IV in a very high risk cases. Has to be administered multiple times.
B.
Yes,
C.
B is the right option. MCQ number 3. WHO has strongly recommended discontinuation of production and use of nerve tissue vaccine, the replacement by modern concentrated CCVs. These can be given as pre-exposure prophylaxis, post-exposure prophylaxis, pre and post-exposure prophylaxis, terminally sick patients, obsolete now.
A.
C is the right option.
C.
Yes. MCQ number 4. A person ABC loves to travel in his car driver profession. Traveler ABC comes to your clinic after getting 2 doses of a vaccine 6 months ago and next week is traveling to an endemic area for rabies. What should a physician do? Start the scheduling again and get him to cancel his trip. Give 1 dose of vaccine, assume he has good cover. Order the same vaccine he used and give him 1 extra dose, assume he already has enough cover. B is the right option. MCQ number 5. A 19-year-old frightened college boy came to DHQ Hospital Saiba after minor bite of farmer's dog in a playground of a college. Upon inquiry, he told the dog bites him when he went near a dog to pick his ball. Dog's owner told him that the dog is not vaccinated. However, the dog is otherwise healthy. He's worried about getting the rabies and wants to get vaccinated for rabies. How will you counsel this boy regarding vaccination? A. All dog bite victims should get rabies vaccine. Advising to observe the dog for any illness in dog for 1 week. No need of vaccination in minor bites. No use of vaccination after exposure.
B.
B. Yes, B is the right option. MCQ number 6. A 40-year-old man came to emergency at 2 a.m. after the bite of a stray dog while he was going to home from the railway station. He got 2 by 3 centimeter wound on his right arm. What immediate step is needed regarding his wound management? Apply suture dividing, change the dressing daily. Wash the wound with normal saline, apply suture. Wash the wound with normal saline, let it open for secondary closure. Apply bandage and prescribe broad spectrum antibiotics.
C.
Yes, is the right option. MCQ number 7. Rabies is a vaccine preventable viral disease which occurs in more than 150 countries and territories. 40% of people bitten by suspected rabid animals are children under 15 years of age. To prevent rabies, which among the following public health measures are best? Kill all stray dogs, vaccinate all dogs, add the rabies vaccine to the country's immunization schedule, capture all animals that bite to observe them for 15 days to guide medical management.
B.
Yes, B is
B.
the right option. B. MCQ number 8. The rabies virus is an agent size is 180 by 75 nanometer, has lipoprotein envelop M protein layer, is passed on by contact with what part of an infected animal? Skin, saliva, blood, claws, urine.
Saliva.
Yes,
B.
right option. Yes.
B. Saliva.
Yes, right. MCQ number 9. A villager from southern Punjab brought to tertiary care hospital in Lahore with restlessness, irritability, agitation, fear of annoying voices, bright light, water and food. His pet dog bites him 7 weeks ago, which later dies after a few days. Choose the correct option. Start a course of rabies vaccine immunoglobulins. Treat him for some other disease as not suffering from rabies as there is a long time past when a dog bites him. There can be better health outcomes if he is properly treated. Patient's life can't be saved.
A.
No, D is the right option. MCQ number 10. A man is bitten by his pet dog in Lahore. He noticed a strange behavior in his dog from few days that he is not eating well, extreme aggression, unusual bark, excessive salivation, fear of water. Choose the best option regarding the medical management of this victim. Patient's life can't be saved with any measure. Patient's life can be saved if proper and timely vaccine and immunoglobulin are administered. A patient's life can be saved if vaccine and immunoglobulins are administered after the onset of rabies symptoms. No use of vaccine and immunoglobulin once a rabid dog bites human.
B.
B.
Yes, B is the right option. So this is a key of MCQs. This is the YouTube link of the presentation. And thank you.